Congratulations! You either are about to, or you just had a bad tooth, or maybe even several bad teeth removed and have taken a big step towards a healthier mouth. Postoperative care after a tooth extraction is very important, and unnecessary pain and complications can be minimized if instructions are followed carefully. Discomfort after dental extractions is usually fairly minor, and over-the-counter pain medication will be all you need. Please take 3 pills of ibuprofen, such as Motrin or Advil, plus 1 tablet of Tylenol Extra Strength 3 times a day for 5 days. This is a total of 600 milligrams of ibuprofen plus 500 milligrams of acetaminophen 3 times a day for 5 days. Discomfort usually peaks at 3 to 5 days and should get substantially better thereafter. If you experience increasing pain after 3 to 5 days, you may have developed a dry socket, a fairly common complication after dental extractions. A dry socket occurs when the blood clot dislodges from the extraction socket and an infection develops. Other than increasing discomfort, you may also experience a foul taste or smell. If you think you have developed a dry socket, please give me a call. Stiffness or tenderness of the jaw muscles may cause difficulty in opening your mouth for a few days following an extraction, especially if your extraction was complicated or if you're suffering from a temporomandibular disorder. This is a normal postoperative event which will resolve on its own within a few days. To minimize bleeding, sleep with your head elevated and avoid heavy exercise, such as running or lifting weights, for at least 1 week. You can start light exercise, such as brisk walking, swimming, or mowing your lawn during the 2nd week. After 2 weeks, you should be able to exercise normally again. A certain amount of bleeding is to be expected following an extraction and usually stops on its own. If bleeding does not stop, take one of those sterile pads of gauze we're giving you today, make it moist under clean water, and firmly bite on the pad at the area of bleeding for 15 minutes. Make sure you clean your hands well before touching the pads so you don't transfer any bacteria to the extraction site and potentially cause an infection. Postoperative swelling after dental extractions is usually minor. Swelling will not be visible until the day following your extraction and will not peak until 3 to 5 days. Please apply an ice pack or a bag filled with frozen peas to the side of your face where you had the tooth removed. Ice should be applied 10 minutes on and 10 minutes off for the first day. Make sure that you never apply ice directly to your skin to avoid frostbite. After 24 hours, ice has no beneficial effect and you should stop using it. Today, please wait to eat something until your numbness has worn off. This should take about 2 hours but varies widely in between patients. For a period of 3 weeks, chew away from the extraction area and stay on a soft diet, avoiding anything hard or crunchy that may get wedged into the extraction site, such as popcorn, cereal, nuts, or seeds. Please avoid anything overly hot, citric juices, carbonated beverages, or acidic foods like tomatoes. Please do not use a straw or rinse your mouth for the first week, since this can cause the blood clot to be dislodged, causing a dry socket. You should brush and floss the areas not worked on today, as you usually would using your electric toothbrush and floss. However, the extraction site should be left alone entirely for the first week. After 1 week, start brushing your teeth gently in the area where the tooth was removed using the soft bristle toothbrush we're giving you today. After 3 weeks, you may go back to your normal routine using an electric toothbrush and flossing also in the area where the tooth was removed. For the first 3 weeks, do not use a water pick around the area where the tooth was removed. If you feel that something is stuck in the extraction socket, please try to remove it carefully using a Q-tip. Complication rates triple with smoking. Therefore, smoking is absolutely prohibited for at least the first 2 weeks after the procedure. Several of my patients were able to quit smoking after a dental surgery I provided, and I'm sure you can do that too. This is a perfect time to quit. Sutures sometimes become loose. This is no cause for alarm. Just remove the suture from your mouth and throw it away. The sutures I may have used today are all resorbable, and they will dissolve within a period of 10 days. Now, thank you for choosing our office and for trusting me and my team. Please feel free to call the office or my cell phone if you have any questions or concerns. It is never a bother. My cell phone number is in the post-op instructions we're giving you today. If I can't pick up, please leave me a message. I'll promise I'll call you back as soon as I can.